Hello, my name is Orfao, and I'm honored to present our work comparing computer vision methods for the combined detection of glaucoma, diabetic retinopathy, and cataracts. I'll start with the introduction and then move on to the research question, similar works, experiment setup, the experiment, the results, and lastly, the conclusion. Computer vision has a place in many industries. One industry that stood out to us is the medical field, where it helps medical professionals diagnose diseases to treat patients. The diseases our research focuses on are glaucoma, cataract, and diabetic retinopathy, which are highly ranked eye diseases known to cause blindness or vision impairment. Glaucoma is a group of conditions that damage the optic nerve. The damage is often caused by abnormally high eye pressure due to slow fluid drainage or fast fluid production. Effects on vision, such as blind spots, only occur in advanced stages as the optic nerve deteriorates. A cataract clouds the normally clear lens of the eye. Aging and damage to the tissue that makes up the eye can result in a cataract forming. As a cataract continues to develop and enlarge, the lens becomes more clouded and distorts the light passing through it. Diabetic retinopathy is a complication caused by diabetes. Too much sugar in your blood can lead to the tiny blood vessels that nourish the retina getting blocked. The eye may attempt to grow new blood vessels, but they might not develop properly and may leak easily. All three of these diseases can lead to blindness if untreated. Fortunately, further damage progression can be prevented if these diseases are detected and treatment is sought after. This forms the basis of our research question. Can multiple eye diseases, such as glaucoma, diabetic retinopathy, and cataract, be identified using one deep learning architecture? A vast amount of research has been conducted, focusing on glaucoma, diabetic retinopathy, and cataract detection. Akaya and other researchers have created a method for the automated diagnosis of glaucoma using textural and higher order spectral features. Higher order spectra features were extracted using a radon transform, and textural features were extracted using a gray level co-occurrence matrix. These features were combined and then classified. 4 classifiers were investigated: a support vector machine, sequential minimal optimization, random forest, and naive Bayesian. A random forest classifier combined with the Z-score normalization and feature selection methods performed the best with an accuracy of 91.7%. The advantage of this approach is a high accuracy was achieved. However, textural components are vulnerable to lighting interferences. Jiao and other researchers have developed a computer-aided system for cataract classification and grading. The feature extraction utilized the intuitive approach that a fundus image with a cataract would show less detail of the optic nerve. The Haar wavelet transform was used, and the number of coefficients in the amplitude regions were used as features for the classification and grading with the multi-Fisher algorithm. A 90.9% and 77.1% accuracy was achieved for the cataract classification and grading, respectively. The advantage of this approach is the intuitive way to classify and grade cataracts. Also, the Haar wavelet transform is not resource intensive. Singh and other researchers produced a method for the automated detection and grading of diabetic retinopathy. The images were resized to 150 by 150 pixels. A custom convolutional neural network was developed for both the detection and grading of diabetic retinopathy. A 76% and 56% accuracy was achieved for diabetic retinopathy detection and grading, respectively. The advantage of this approach is a convolutional neural network can learn the features associated with abnormal and rare cases. The disadvantage of this approach is a low accuracy was achieved by both models. We conducted a literature review to investigate what has already been done in terms of using computer vision to detect eye diseases. Multiple methods have been used to successfully detect the presence of glaucoma, diabetic retinopathy, and cataracts. To the best of our knowledge, no approach has been used to detect all 3 diseases with a single pipeline. Our literature review exposed the potential of using deep learning to classify all 3 diseases, which is the route we took. For the experiments, the publicly available Ocular Disease Intelligent Recognition Structure Ophthalmic database was used. It contains left and right retina fundus RGB images of 5,000 patients aged 1 to 90 collected from various hospitals. The images were annotated with quality control management by trained staff. Of the 8 categories, the experiment utilized only 4, which are normal, glaucoma, diabetic retinopathy, and cataracts. 150 images were randomly selected from each utilized category to prevent a class imbalance. Dataset augmentation was performed by randomly rotating and zooming in on each of the images, which increased the image count to 1,649 in each category and 6,596 images in total. The images are all 224 pixels by 224 pixels and are randomly divided into 80% training and 20% testing. This produced 1,319 training images and 330 testing images for each category. During the literature review, we found that the green channel in an RGB image is less sensitive to noise and achieves better feature highlighting. 2 versions of each model were trained to compare the effect of the green channel extraction with the standard RGB images. The models trained using the images consisting of only the green channel are labeled as green, and the models trained using the standard RGB images are labeled as normal. We investigated 3 separate pipelines to determine which could produce the highest performance metrics. Pipeline 1 and 2 utilize the traditional computer vision approaches, and Pipeline 3 utilizes various deep learning architectures. In total, 12 deep learning models and 8 support vector machine classifiers were trained. The deep learning parameters of interest are a batch size of 32, pixel values of scale between -1 and 1. The atom optimizer with categorical cross-entropy loss was used for training, and early stopping with a patience of 200 was used. The Inception V3 normal model achieved the best performance with a weighted F1 score of 99.39%. The SqueezeNet Green was the worst performing deep learning model with a weighted F1 score of 81.29%. The RBF SVM that extracted histogram of oriented gradient features from the green channel images was the top performing support vector machine classifier with an F1 score of 76.48%. The linear support vector machine that extracted gray level co-occurrence matrix features from the normal RGB images performed the worst with a weighted F1 score of 47.33%. These graphs depict the F1 score for each model with the normal and green versions beside each other. The green channel extraction was not effective for the deep learning models as it performed poorly compared to the RGB versions of the model. However, in the SVM models, the green channel extraction images performed better than the RGB images in some cases. Thus, the green channel extraction might be better suited for SVM pipelines. When analyzing the misclassifications, there was evidence of more than one disease present in the retina images, as depicted in the slide. In both images, the retina is primarily opaque, which indicates the image could contain a cataract retina. Furthermore, the size of the optic disc present suggests that the retina image could contain glaucoma. These multi-disease retina images have led to an unclear decision boundary in the support vector machines, which is the cause of their poor performance. The reason for these multi-disease images is due to one disease causing another. For example, a cataract can block the natural drainage system of the eye if it is large enough, increasing the pressure on the optic nerve and thus causing glaucoma. With the results achieved by the Inception V3 normal model, we could easily integrate it with the computer-aided system to facilitate the screening process for the detection of glaucoma, diabetic retinopathy, and cataracts. The green channel extraction did not improve the deep learning models. Glaucoma, diabetic retinopathy, and cataracts can accurately be detected using a single architecture. Thank you for watching our presentation on a comparison of computer vision methods for the combined detection of glaucoma, diabetic retinopathy, and cataracts. It has been a pleasure presenting our work, and we wish you all the best.